A toxin or foreign substances that induces an immune response in the body is known as A. Complements, B. Antigen, C. Antibody, D. All of the above. And the right answer is B. Antigen. Foreign antigens originate from outside of the body. These antigens induces an immune response in the body, especially the production of antibody. Example of foreign antigens are viruses or microorganisms, substances in snake venom, certain proteins in food, and components of blood from other individuals. Drug that relieves flatulence is known as A. Carminatives, B. Purgatives, C. Antacids, D. None of the above. And the right answer is A. Carminatives. Carminatives are the drug that relieves flatulence. Purgatives are the substances that loosen the stools and increases the bowel movements. Antacids are medicines that neutralize the acids in stomach to relieve indigestion and heartburn. Macrophages are responsible for A. Phagocytosis, B. Pinocytosis, C. Apoptosis, D. Endocytosis. And the right answer is A. Phagocytosis. Phagocytosis is a cellular process by which certain living cells called phagocytes engulf and eliminate microorganisms, foreign substances, and dead cells. Against infection, phagocytosis is considered as A. First line defense, B. Second line defense, C. Third line defense, D. Fourth line defense. And the right answer is B. Second line defense. The immune system can be divided into three basic lines of defense against pathogenic infection. The first line of defense are the surface barriers that prevent the entry of pathogens into the body. For example, skin, mucous membrane, secretions of skin and mucous membrane. The second line of defense are the non-specific phagocytes and other internal mechanisms. For example, phagocytic leukocytes, antimicrobial proteins, inflammatory response, and fever. The third line of defense are the specific lymphocytes that produce antibodies. For example, lymphocytes, antibodies, memory cells. The pulse assessed from the neck to the side of windpipe is called as A. Brachial pulse, B. Carotid pulse, C. Nuchal pulse, D. Popliteal pulse. And the right answer is B. Carotid pulse. The carotid pulses take oxygenated blood from the heart to the brain. The pulse from the carotid may be felt on each side of the front of the neck just below the angle of the jaw. 4 teaspoons are equal to A. 12 ml, B. 20 ml, C. 40 ml, D. 60 ml. And the right answer is B. 20 ml. 1 teaspoon is equal to 5 ml, so 4 teaspoon will be equal to 20 ml. Temperature regulation is under the control of A. Lungs, B. Pituitary glands, C. Hypothalamus gland, D. Pineal gland. And the right answer is C. Hypothalamus gland. Other important functions of hypothalamus glands are releasing hormones, controlling appetite, regulating body temperature, managing of sexual behavior, regulating emotional responses, maintaining daily physiological cycle. To perform Foley's catheterization, the nurse should place a female patient in the A. Dorsal recumbent position, B. Lithotomy position, C. Supine position, D. Side lying position. And the right answer is A. Dorsal recumbent position.